So when we are talking about depression, one must realize that this is a disease. It is not something that just exists because a person is not feeling happy or that he's had a bad day or things like that. There are a whole bunch of criteria that have to be followed before one reaches this as a clinical diagnosis. Depression happens to be the commonest psychological disorder, and unfortunately we are seeing it being manifest in younger and younger age groups. Many years ago, we would say that it starts around the age of 16, 17, 18. Today, my colleagues and I are diagnosing it even at 9, 10, and 11, which is a very sad indictment of the kind of times that we are in. Every person who's sad is not depressed. Every person who cries is not depressed. So there are a whole bunch of criteria that have to be followed, and we look at it over a 2-week period at least. So if for most of the time during that 2-week period you're down, you're sad, you feel upset all the time, there's a certain amount of feeling of worthlessness, uselessness, and guilt. Your body symptoms get affected, your body functions get affected, you'll end up very often having a problem with appetite, you eat too much or too little, you sleep too much or too little, there may be a problem with urination, your sexual functions usually get disturbed. Very often people start crying for no reason, very often there's a feeling of difficulty in concentration. If you're a kid, sometimes the only symptoms that you experience are somatic symptoms, where you'll start having aches and pains and a headache and things like that. And you're taken to the pediatrician who checks you out, does all the tests, and then comes to a conclusion that there's no real physical reason for what is happening. And then you'll end up being sent to the psychiatrist, who will then diagnose possibly the presence of a depression, which leads to somatic symptoms. What are the causes? And how does it happen? At one time, we used to believe that there was only a neurotransmitter issue, that there were certain neurotransmitters in the body which get affected. Today, we know that there are an enormous amount of genetic influences and that basically everybody has the propensity of being depressed, but there has to be a kind of an environment in which there are stresses which then topple over the compromised individual, who then lands up being either anxious or depressed or having some other kind of psychological disorder. So we are looking at it in terms of a genetic issue, we are looking at it in terms of neurotransmitter, connective issues, we are looking at it in terms of we have electronic circuits in the brain which get compromised. Sometimes there are actually brain structures which get affected. A combination of all of this with the right environmental stimulus topples you over, and then you'll end up having a kind of a depressive episode. If we are lucky, then the depression is a one-time thing, given adequate treatment for an adequately long time period, there may be no recurrence. But very often this does not happen, so you might land up having recurrent episodes, or you might land up having an episode which is not really coming under control, which we call resistant depression, which is a different ballgame in itself. What are the environmental factors? There are lots of them, and sometimes there may be no obvious environmental factor, but the usual stresses that we do see are, especially in the youngster, a breakup of a relationship, too much of stress related to academics, if the parents are constantly fighting, if there is some kind of sexual dysfunction, if there is a lot of sexual molestation or abuse that happens. Very often now, a person in the LGBT community also lands up being depressed because he finds it difficult to cope, and very often he may not be able to come out to his own family, which leaves him being bereft. All of these are the common reasons as to why a person might end up having episodes of depression related to the environmental factor. But very often we don't see an environmental stimulus. So I'm asked by a lot of people, then why is he depressed? He's doing well, he has a girlfriend or boyfriend, he might land up having the future as being very bright, they are well-to-do, etc., etc. It's like saying, how can a person with all of this ever get a heart attack? A person is susceptible, he's susceptible. If there's a genetic influence, there's a greater than normal chance that he might end up having depression. So one looks at it in that perspective. And probably the worst thing that one should do is to look at it and say, oh my God, you're a weak person, oh my God, let's go out for a movie, let's go out for a play, let's go out dancing and everything will be fine. Have an extra drink and everything will be fine. All of that is nonsense. It is a disease which needs to be treated as any other disease should be. So now what are the various treatments that are available for depression? If the depression is extremely mild, maybe counseling and therapy is all that is needed. So there are studies to show that something called cognitive behavior therapy is fairly effective for very mild depression. But if it is moderate and severe, if the person is incapacitated, if there is a suicidal intent, which is one of the biggest complications of depression, then it is necessary for the person to be put on medication. Sometimes it might be necessary to admit the person. If the person is aggressive or doing things either to hurt himself or threatening to do things to hurt himself or somebody else, then it is necessary for you to admit the person. Medications are of various types, and there are a whole bunch of myths about medication which are stupid. So what we must realize is that medications do not make you a zombie. They do not make you, put you under the power of the doctor. You're not going to necessarily sleep too much or sleep too little, eat too much or eat too little. The doctor will make a calculated evaluation and decide which family of medication to put you on. If he feels that there's a necessity of a combination of medications, that will be done and he will explain it to you. It has to be taken for as long as the doctor feels is necessary, not as what you might think. And please don't listen to the other person who says you must not do this, because these other persons don't know what they're talking about. And certainly Dr. Google is not a doctor, so please let's not listen to Dr. Google. These are very, very important issues because by and large, resistant depressions and recurrent depressions are contingent on proper treatment, which is not going to happen if you do not follow what a qualified doctor suggests you should do. You must realize that just like if you had a fractured hand, nobody is going to ask you to do yoga. You go to the doctor, undergo plastering or an operation if necessary. Just like that, it would be stupid of you to expect that if you have a severe depressive episode or you're suicidal, that doing yoga and doing exercise and going to the gym is all that is necessary. It is not necessary. It is not enough. It is essential for you to get a proper evaluation by a doctor who will then decide what to give you. If medications work, that's wonderful. There are also other treatments. Occasionally, electric shock therapy might be necessary. There are a whole bunch of myths associated with that as well, which are unnecessary. You're not going to have major problems with that. In the past, it was used profusely. Today, it is still used, and it is still an extremely important method of dealing with suicides, especially those who are very agitated or those who are extremely depressed and suicidal. There are also other treatments similar to that, which are now in existence, things like recurrent transmagnetic stimulation, which is again a different technique which is used now. The important thing is for you to seek help. The important thing is for you not to believe that you can control it by yourself. Just like if you had a cough or a cold or you were getting breathless or you had high blood pressure, you wouldn't think twice about going to a cardiologist or a general physician to get a proper evaluation and proper treatment. You also need to be aware of the fact that depression is a disease and you need to go to a psychiatrist without taking into account the fact of what will people say and what will happen and so on and so forth. All of these are myths which do not need to be pandered to. In today's generation, it is absolutely essential that you undergo proper treatment for what is a disease. You go to a qualified specialist who knows what he is doing, and I have no doubt that the recovery will be very good.